Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 305 of the Ask Dr. Angela podcast. It's so good to be back. I've been on hiatus for a really long time. Not quite a year, but pretty darn close. And this week, I released a blog post, and again, it had been almost a year, not quite, and it was so well received. I appreciate all of the positive feedback that I got back from you all. I appreciate your continued support, and I can't tell you the number of emails, text messages, etc. I got with regards to that blog post that really was just a reintroduction of myself for those of you that don't know who I am, but it really was also a hello, in the midst of everything that's going on. I am located in New Jersey, and we are the second hardest hit state with regards to COVID-19 cases, right behind our neighbor, New York. So, needless to say, we are on lockdown, and I'm not quite sure. I think that we're going to be reopening New Jersey on May 1st. That remains to be seen, but you know what? You just go with the flow and take it as it comes. That's one thing that I have learned to do over the past year. So, as I previously stated, I have been away for a while, just dealing with life and everything that goes along with that. And as a result of that, I've had a ton of queries, questions, direct messages. The questions just keep coming in and coming in and coming in. And so in an attempt to respond to all of those, I'm not going to respond to everything via email. I'm going to just start answering some of those questions on the podcast. It'll be easier and a way really to share information with the broader audience in general. So here is a message from a young lady that says to me, Dr. Angela. She didn't leave her name. But the question is, Dr. Angela, do genital warts recur after having them removed? That's actually a really good question. And the answer to that is a resounding yes. They absolutely can recur. Why? Because HPV is the cause of genital warts. Typically benign types of HPV cause genital warts. And HPV stands for human papilloma virus. It is a virus that causes the genital warts. And because it's a virus, it can come back. So just a little bit of history about genital warts and HPV. Roughly about 80% of the population at some time or another has had an exposure to human papilloma virus, more commonly known as HPV. In the realm of OBGYN, to make our lives much easier and really to better explain it to patients, I generally divide HPV into two groups, high-risk HPV and low-risk HPV. Low-risk HPV types are generally the ones that are associated with things like genital warts. And you all know genital warts. They're those ghastly, unsightly lesions that can appear on your vulva, the perineum, around the anus. They can even occur inside the vagina. They, again, are caused by low-risk types of HPV, human papillomavirus, and remember, HPV is a sexually transmitted infection. People don't necessarily realize that. And again, visually, they're not very appealing. They can be cauliflower-shaped. They can occur in bunches. They can occur alone. They can sometimes cause discomfort, sometimes itching. They can sometimes, bleed. They're just kind of a pain in the tuchus, so to speak. Risk factors for getting genital warts are going to be, sexual things. If you have a lot of unprotected sex with multiple partners, history of previously having any kind of sexually transmitted infection or STI, if you have a compromised immune system for whatever reason. Certainly, there are very many treatment options for human papillomavirus warts, and it can be any number of things. Some people will observe them. Some people undergo laser treatment. I don't do laser treatment. A lot of my friends in the realm of GYN oncology do laser treatments. This is typically reserved when people have a large amount of warts. In office, sometimes we do something called TCA treatment, trichloroacetic acid treatment, where we literally burn them off. There are topical outpatient treatments. Aldera is something that comes to mind. It's a topical application, usually in cream form, that you apply, I want to say up to 3 times a week. And you usually put it on at night and you wash it off in the evening. You can use that for up to 16 weeks, I do believe. But anyway, genital warts are very common. And I guess getting back to the original question, yes, they can recur after you have them removed. So there you have it. That's a great question. And I'm really happy that you submitted it. I'm sorry that it's taken me so long to get to this, but sooner is better than later. I guess that didn't come out right because this was much later. But anyway, thank you again for submitting your question. I really appreciate it. So I would really like to say thank you for tuning into this episode of the Ask Dr. Angela podcast. Appreciate all of the love and the support. Please, please, please connect with me. You can reach me at www.askdrangela.com. That's askdrangela.com. You can sign up for my blog post there. You can send me an email there. You can sign up for my social media channels. That's Facebook, Instagram, Twitter, my YouTube channel. So I'm going to leave you with something from one of my favorite books by Sandy Gingras. I always close with a saying, and this is from the book She Went Out on a Limb. It's a book of inspiration for women. And the particular page and picture that I'm looking at today shows a woman that's standing in front of, I guess it's kind of like a coat rack, and it has different tags on each hook. And there's a tag for happy, a tag for sad, a tag for angry, moody, scared. And then the woman says, as she looks at the rack, "Today I will be," and then at the bottom of the page it says, "Choose happiness." So today she will be happy. Today you will be happy. Today I will be happy. And I actually changed the ending. Before I was saying look better, feel better, be better. But now, in the midst of everything that I've been through over the past year, I am saying choose happiness. So I am going to log off to you by saying thank you so much for tuning in to today's episode. I cannot wait to reconnect with you on episode 306. And in closing, choose happiness. See you soon.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.